Good afternoon, everybody. I'm Greg Fisher, the mayor of Louisville. Thank you for joining us. Well, prior to this call, we just finished an internal call with our operations team. We're on day 362 of our COVID response. Almost as surreal, isn't it, to think this started a year ago and all we've been through as a community and as a country through here. But we're in a much better spot right now. We know what we're up against. We've got some really effective tools to fight this virus and a more effective process to get us closer every day to beating and eliminated COVID-19. We're starting our second week now with 3 approved vaccines now that the Janssen vaccine is being distributed. Janssen has been highly effective in preventing severe illness and death from COVID-19, as are the other 2 vaccines, and that obviously is the name of the game right now. One thing we like about the Janssen virus, it requires only one appointment and one shot. We're going to be talking a lot about that during this press conference. And the Janssen vaccine is going to simplify scheduling and logistics needed to get more people vaccinated more quickly, especially for folks that are difficult in terms of having 2 appointments with, like the Moderna and the Pfizer vaccine require. We are now working with pharmacy and hospitals and other community partners to get as many shots and as many arms as efficiently and equitably as possible. President Biden said last week that there will be enough supply by the end of May so that every adult who wants to will be able to be vaccinated. So, of course, that's incredible news and is really moving up the timeline to get us to herd immunity. So that's a lot of progress and a lot of hope. And it's a really clear sign that victory against this virus could be in reach if we all do our part to get there. Because remember, this virus is doing everything it can to defeat us, and it's going to continue to mutate and move around and try to get away from our offense. But we've got some new guidelines from the CDC that also indicate that things are getting better. They're outlining how vaccinated people can safely gather indoors. That's good progress and exciting. That means some people can go ahead and visit and they can hug their grandkids and kids and haven't been able to do that in an awful long period of time. And then others are just a short distance away from that as well. It seems like the number one question that people will ask me when I see them is, have you got your shot? What kind of shot? So the shot talk is the something that everybody is interested in these days. So that's good. We need that level of awareness in our community. So until you can get vaccinated, you still have option to wear your mask every day. So we're saying don't let your guard down, don't let your mask down. Masks have been proven scientifically to be really, really effective. So please continue to do that and social distance, wash hands, everything that we know about. So we're making good progress, but it's like we're at the end of a game, and we can see the goal line and we know we've got to stay focused to get across that, and we've got to stay focused or else we're going to lose the game. So this is the time to bear down even more and kind of use that excitement to fight off any COVID fatigue that we have out there. So let's take a look at where we're at with COVID right now. You're going to see our numbers are improving. They're not where they need to be, but the trend is our friend right now and moving in the right direction. So to talk about that is Dr. Sarah Moyer, our city's chief health strategist and director of our public and health and wellness department. So Dr. Moyer, welcome.
Thanks, Mayor. Like you, before I dive into the data, I really have to acknowledge that 1 year ago yesterday, you and all the media joined us in the media center at Metro Safe for a press conference where we announced our first case of COVID-19 in Louisville. It was a unnerving experience, all the reporters, cameras, lights, and so many questions about the quickly moving virus that we had not seen before and knew so little about. And as we reflect back over the past year, I think about how much our lives have changed, especially for the 953 families that have lost a loved one in the last 365 days, and the 7,536, 367 Louisvillians that have had COVID. But my heart's also so full of gratitude, gratitude for how quickly medical experts moved on learning about COVID. We went from being crammed into a room for a press conference to stay-at-home orders, spacing, masks, and hand washing, to just 1 year later, CDC releasing guidelines that those that are fully vaccinated are able to have small gatherings inside again without masks. I'm also really grateful for my team. Our public health and wellness employees are dedicated to helping others. So many have given up time off, worked holidays, long days during this COVID response over the last year. We pulled so many people from their normal jobs to help with special areas of the response. and none have complained, and all served our community with grit, dedication, and compassion. Uh, I'm also grateful for team members, community leaders, and partners who willingly collaborated with us to fight equity, to help those in our community who have been impacted by historical injustices, systems of power, and racism to have access to testing, safe places to isolate, and essential needs while doing so, and more equitable access to the vaccine now. And especially grateful to the residents of our community. A lot has been asked of you this past year, and it hasn't been easy. We've made so many sacrifices, missed so many moments. So thank you for listening and following our advice. Thank you for wearing your masks, limiting where you go, and washing your hands. Thank you for getting tested and cooperating with our care advocates on our contact tracing team. You really did help to save lives. Um, and with that, like really starting to have optimism now with spring and sunshine, and that before our 1 year anniversary of our first case, we have 3 safe and highly effective vaccines available to us. We know, as you mentioned, our supply is going to increase in over the coming weeks. So please, when it's your turn, get vaccinated. It'll help you protect yourself, your family, and those most vulnerable in our community. And please continue to keep wearing your mask in public, keep getting tested, keep washing your hands, until the majority of us are vaccinated. We still need those precautions to keep our community safe. So with that, I'm going to ask Scott to pull up the data and go through that really quickly here. So yeah, continuing that optimism, we are still in the orange and case counts are continuing to trend down. We had just over 1,000 cases last week, which put us into equal about a new cases as September. So that trend line there is still going down, not quite as steep over the last couple of weeks, but we are still heading in the right direction and are still in that orange category. Deaths wise, 26 last week, so still very high. We know that deaths are delayed from case count, and so I'm hoping in the next coming weeks that will also start trending down. Vaccinations, we have given over 200,000 vaccines in our community. Those numbers were last updated on Sunday, so it's even more than that now on Tuesday. And last week set a record with 23,000, over 23,000 new people getting their first dose of vaccine just last week. So you see those numbers continue to increase, and we're going to continue to see that go up in the coming weeks and months as well too. Hospitalizations are continuing to trend down. We are in numbers equal to October, so keep heading in the right direction. Majority of our cases that are hospitalized are in those older age categories, so over 60 and especially over 70. So as we keep moving forward here, if you have friends, family members who have not gotten vaccinated yet, that are over the 70 category, please help them sign up on our website. Lots of partners, pharmacies now offering the vaccine. And if no spots are available, get your name on the Norton wait list, and we start to go through that at our LUVAC site as well. So moving then on to the demographic data, or the map too. You could see overall going down to the next map with the case colors that we are, almost the entire community is in the orange, and even some starting to be in yellow. So continue to head in the right direction. There's even one little tiny zip code there in green. So hoping to see more of those brighter colors in the coming weeks. Demographics, pretty much the same, just like before. A majority of we had a higher number of Black and Brown cases over the summer of last year, and since then, majority of our cases have been in our white population. You'll see in that first graph there that we have, based on the population, more white people have had COVID and are dying from COVID here in Louisville. And then finally, with vaccinations, and I guess you could see there all age groups are trending down, so that's really positive. We still have overall, with all of our categories 1A and B, a slightly more white population has been vaccinated compared to our non-white. But if you click on that 70 box like you're about to, and 70 and older, the reverse is true. So continuing to make progress on vaccines and equity. And so again, Please, there's more and more sites popping up, more vaccine available, and so please help encourage friends and family members to sign up for that. Especially if you click on that map later, you'll see we have a lot more females than males getting vaccinated. So talk to your grandfathers and parents and make sure they are signing up as well too. So that I will turn it back over to you, Mayor, and thanks. Glad to share more positive news today.
All right. Thank you, Dr. Moore. Thank you for that nice encouragement to the guys out there. Always behind the ladies. Let's pick it up, guys. Need to do better. Hey, Dr. Moore, before you go, I wanted to ask you, CDC put out some new guidelines yesterday. If you could summarize what you think the top points are from those.
I think my favorite one is 2 weeks after you're fully vaccinated. And so if you're at the Pfizer, Moderna, it's 2 weeks after that one. If you get the J&J vaccine, the 1-dose shot, it's 2 weeks after that vaccine. You are fairly safe. And so you're allowed to have small gatherings with other people that are fully vaccinated without a mask on and even inside. Grandparents can hug their grandkids that might not be vaccinated if they are fully vaccinated. So just a lot of encouragement with that, with the effectiveness of the vaccine and the safety of it, that we can start doing some of those things that we love to do pre-pandemic and hopefully don't have to worry about getting COVID. With that said, until our whole community can get vaccinated, still encouraging everyone to wear a mask when they're in public places. So if you're going into the store, if you're outside a small gathering and you don't know if people have been vaccinated, still need that mask and that spacing and that hand washing. And the small gatherings, my team just nicely point out to me that those are at home, those are not at work. And so it's still encouraging just home gatherings where you know the vaccination status of everyone. Will help us keep going in the right direction.
Okay, thanks for that. So just encourage everybody to go to the CDC website to see more details on that. But a lot of good news as the science gets more momentum behind it in terms of understanding what vaccinated people can do and not do. So good news there. Okay, Doc, we'll move on to another topic and maybe chat with you later with the media. But right now, what we want to talk about is, one of the concerns for us as a city and for everybody across the country is how do we ramp up our vaccination efforts with our homeless population to make sure we're detecting with testing if there's a problem, but then go ahead and vaccinate everybody, just like we do with the rest of any other segment of our population. So vaccination efforts aimed at our homeless Louisvillians are well underway. That's good news. And I'm happy to welcome a member of our community partners who are working with Metro government on the homeless challenges. First is Aaron Rutherford, monitoring and training specialist with the Coalition for the Homeless. Welcome, Aaron. Delanor Manson is the CEO of the Kentucky Nurses Association, a frequent guest and a woman who wears many hats. Thank you, Delanor. And Bill Wagner, the CEO of Family Health Centers. And then Kathleen Exline, Vice President of Performance Excellence and Care Continuum with Norton Healthcare. So thanks to all of you all, and thanks for your work and your partnership. So we're gonna have a little conversation about what we're doing with our homeless population right now. So Aaron, let's start with you for some background. How have the various shelters and homeless service providers been navigating through COVID?
Oh, that's a loaded question.
Yep.
We have been doing a lot during COVID over the last year, but I think most recently with the vaccine efforts, we're happy that Louisville Metro Public Health and Wellness is going to set aside 1,500 of the Johnson & Johnson vaccines. We are trying to target the shelters first, just because we've noticed that that's where the outbreaks are most likely to happen, just because people, are in that congregate setting. Even though all of the shelters in the last year have drastically, changed their operations to allow more distancing between beds, setting up, new pop-up shelters. But basically, because of, the outbreak data, we are going to be focusing on shelters first. So we are starting with Salvation Army and Wayside Christian Mission because they have the most amount of people in shelters, and that will start next week. Then we're going to move on to some of the other smaller overnight shelters. We'll also move on to some of the day shelters like St. John's Center for Men or UP for Women and Children. And then lastly, we'll be moving on to the feeding sites and the different encampments. So that's kind of how our priority level is going to go for those 1,500. And I have been told that once we get through those, there might be the possibility to get even more, but we're going to try and get through those 1,500 first. And additionally, all of the shelter staff and outreach workers have already pretty much gone through the vaccination process as well. So all of the staff should be good to go also.
Aaron, how's it feel? Have the vaccine now.
It's really exciting. It's nice to finally redirect my efforts to something else instead of just COVID maintenance. So this is exciting to see, the next kind of hump that we're going to get over and hopefully get back a little bit to normal.
Yeah, well, congratulations. You guys hit it hard every day. So really appreciate you stepping up at this phase of the journey as well. So stay on, if you will. There might be more questions coming back to you, but thanks to everybody at the coalition. All right.
Thank you.
Delano, let's switch over to you. When I think of Kentucky Nurses Association, I think of dedicated people doing whatever it takes. You guys have been amazing throughout this whole pandemic journey we've been on here. And so part of what y'all are doing is doing testing missions at homeless shelters. So now that we've got 3 vaccines, including a single shot vaccine, what kind of chatter are you hearing from the nurses?
Well, thank you, Mr. Mayor. I'm hearing back from the nurses that they are still excited about going out doing the testing at the homeless shelters. We've tested over 2,000 in the homeless shelters in the last 8 weeks. And we do teaching about vaccines while we're out there doing testing. We never miss a moment. And we are also allowing the nursing students to go out and have the experience of working with people who are less fortunate than they are. And so it's been a very positive experience for us, and we will continue to do it as long as they allow us to come and do the testing and participate in any other way, whether it's vaccine distribution or whatever. But the nurses are there.
And then what kind of awareness level, what kind of conversation are you having or hearing about between the nurses and our homeless friends?
I hear a lot of enthusiastic conversations, because one of the first things you'll observe is how the nurses treat the homeless people with such incredible respect, and how they give them such positive feedback about being tested and wanting to be involved in the vaccinations, and talking about opportunities that might lay ahead once they get vaccinated. So it's a very positive conversation between the homeless and the nurses. And we even have some physicians who go out and do testing with us as well at the homeless shelter. Pretty awesome.
Yeah, that's good to hear. And Bill Wagner, similar question to you. What are you and your team hearing from the patients at the family health centers?
Well, let me just give you a little background. You know, Mayor, that we operate the Phoenix Health Center for the Homeless on East Muhammad Ali, which is next to the St. John Day Center. We have been there for 33 years now. We're the largest healthcare for the homeless program in Kentucky. And we're very fortunate to receive a portion of the allocation of those 1,500 doses that went to the health department. And we actually started administering the vaccine today. Today was the very first day. We're very excited. We didn't really know how it would be received. We'd heard that there was some mistrust on the street. People just didn't know enough about the vaccine. They may have been hesitant to get vaccinated. But based on our first day, and this is small sample size, most everybody that we approached was interested and was able to get the vaccine today. You know, we started off slow, so we got it right. So a majority of the patients that we asked that were coming in to the health center did agree to be vaccinated. And on top of that, we found out we were getting some extra doses too. I know of the vials that we opened, two-thirds of them had extra doses in them, which is a really good thing. We were getting 6 doses instead of 5. So we may be able to spread it out a little further. We have a longstanding relationship with many of the homeless patients. We took care of over 4,300 homeless persons last year. The majority of those are males, by the way, almost 2/3 of them. So we have a great opportunity to get some of our men vaccinated. But I think the trusting relationship that we have, and especially the trusting relationship with the primary care provider, is going to make this a really good way to vaccinate homeless persons. It's quick, it's easy, it's free. They don't have to make an appointment. They can just come by the health center, and we'll try to take care of them.
Well, thank you. You guys do amazing work all the time. And now here's just another act of kindness and goodness you can do. So appreciate you all. Kathleen, another great partner. I want to thank everybody at Norton Healthcare for stepping up. You guys have been just another amazing partner throughout this whole process. And now we're entering another stage where we're going to be deploying mobile vaccine missions to our homeless shelters starting next week. So you all have a lot of experience with these mobile missions, and most recently working with our faith communities where we're seeing tremendous reception to the virus. So tell us a little bit about the goals of the vaccine missions that you're planning now.
So I think that anytime you think about going to an unfamiliar environment to deploy vaccinations, there can be challenges, and that is anywhere from technology to really layout. And so I think our team spent a lot of time on the front end being planful around that to make sure it's an environment that's a welcoming one, and that we really are thinking through the population we're serving to be in the place they are. Clearly, as what's been outlined today, I think the number one challenge is wanting to be able to vaccinate as many people as possible. And so I think that certainly the Janssen product is going to allow us to be able to take those doses and disseminate them more widely. So again, I think there's logistical challenges, but I think that it really is us working closely with those partners that know the population we're serving, and just really, again, carrying out the mission of the organization right where those people come and either get services or come each day.
Mr. Mayor, I think the most important thing that we deliver is trust, that they trust us, that we're going to do the right things for them. We've been there. We've been there for weeks and months, and in Bill's case, years and years. But the key is that they trust that we're going to do right by them.
Yeah, I can't agree enough. And I think that clearly that's where we rely heavily on partners that know that population and that work with them every day. That's their family. And so the people that Bill works with each day, that is the family to that population. And so we have to take their lead. And that is what really paves the way to trust that we're not coming in there and instituting procedures or processes that are going to be off-putting or that be upsetting.
Well, let me ask all of y'all then, this is a big part of addressing vaccine hesitancy if you've got that trusting relationship. But I mean, even if you do, what kind of strategies are you all thinking about in terms of getting people to get over their fears or hesitancies and get the shot?
I tell you, lots of times we'll put information for the general public out on the internet, and we'll print out a lot of handouts, but we feel like the most effective strategy for us here with working with the homeless is face-to-face interaction. We're meeting people as they come into our facilities. We're talking to them, helping them understand the importance of getting vaccinated, that the Janssen is a one-shot easy vaccine. So a lot of it's one-on-one. We have printed materials we can hand out, but we hope then spread through the shelters and on the streets and in the encampments. And of course, we hope to get out beyond the walls of our health center too. We're talking now about how we might deploy a mobile unit to get out to some of the larger encampments and meet people where they are. So a lot of it's going to be one-on-one, face-to-face relationship building.
And just to add to Bill's statement, we have distributed CDC and Louisville Metro Public Health flyers to all of the shelters and the outreach workers. And I know the city offered to print some of those for the grassroots organizations, so I appreciate that offer. So we are really working on making sure that those are hung up at all of the facilities and that the outreach workers have copies that they are passing out through their day-to-day outreach on the street.
Very good. To the media, if you have any questions, please put them in the chat. This will be my last question here to our group here. I guess just Kathleen, anything else you want to comment on in terms of our homeless challenges or our strategies to get them vaccinated as soon as possible?
Well, first of all, I do want to thank all the partners that are on today, and thank you for your partnership. I think the thing that we have to balance is our urgency to want to vaccinate right there. And not everyone's going to be in that place. And so I think we have to use good discernment. I think we have to take good cues to understand where people are, and that it may not be that first interaction that that person will vaccinate. That person could leave and come back an hour later. That person could come back tomorrow. And so that's where I think truly being good colleagues with those folks that have that relationship and taking those cues, that's really the thing that I think's demonstrated the biggest success, because our big challenge now is that we are transitioning from having set appointments and people actively choosing it to where we're having to elicit people's agreement to be in that space in the moment. So I think that will require a new level of collaboration that we're up for. And I just think we have to be attuned to that, because you can push to the point where someone that's almost there that just needs a little time is going to say, I'm not doing it.
Right. Yep.
I think there are two other things, and one is to make sure that you always thank them for allowing us to come and serve them. And the other thing is to talk to the staff, because the staff live there with them. They're with them most of the time. And if you can get the staff convinced, if you can give them enough information so that they can answer questions, then they'll be an incredible resource. And we spend a great deal of time doing that as well.
Mm-hmm. Bill?
I have to just echo what everybody said. We've got a lot of partners in the homeless provider community that we have to educate as well. Many of them have been vaccinated already, but it takes all of us working together. But most importantly, that we have to recognize that they don't live by the same time clock that we do, the same appointment schedules, have transportation difficulties. We have to be flexible, and we have to be flexible, and we've got to just treat them as individuals, meet them where they are, and I think we're going to be successful. I think today's already proven that the recipe for success is there.
Yeah, no, that's great news to hear, Bill, from your organization. Of course, having the Janssen vaccine now is a game changer for us with these populations. So, Erin, we'll give you the final word here.
I don't really have anything else to add other than I just want to thank you all for just highlighting this population through all of your discussions. I think a lot of times the people experiencing homelessness can kind of get swept away or not, receive a lot of attention. So I really appreciate you all putting time and attention on this. I was just on the National Alliance to End Homelessness National Conference today, and there was a lot of conversation about vaccines and also how the homeless population is much greater risk for getting COVID, for getting serious symptoms, hospitalization, and death. So I really appreciate you all really making this a priority. Thanks.
Absolutely. Thank you for the wonderful job you all do 365 days a year. Okay, Jess, let's throw it back to you.
Okay, thanks, Mayor. We have one question in the chat. This one is for Dr. Moyer. Emma Austin with the Courier-Journal asks, is testing still down? If so, how much? Is Louisville's placement in the orange zone representative of COVID-19's actual presence in the community, or just low testing?
Great question. So testing is still down, but our percent positivity rate is trending down just like the states has as well. And so I think it is an accurate depiction. It's accurate to say that our case count is also going down. I don't think we are missing cases. between the test positivity rate and then as well as our hospitalizations trending down as well too. I don't think we're missing cases as much. I'm sure we're always missing a few cases, but the spread has gone down, that we are able to find those that we need to, as well as do contact tracing and making sure people are home and staying home. And so just another reminder about the importance of all the pieces to stop the pandemic. And so as soon as you have any symptoms, please get tested. I know allergy season is starting, and so a good reason, if your allergy symptoms, it's hard to tell if it's COVID or not. And so just the first time you get them, always a good idea to get tested. As well as if you're not vaccinated yet, still recommending weekly testing to make sure you don't have it as well. And we have plenty capacity. So testing is down, but there are plenty of places, thank you, Scott, to go to get tested. All of our partners have plenty of capacity, and so want to keep that up as we continue to see case counts decrease.
Thank you, Dr. Moyer. Our next question comes from Darby Bean with WDRB. And Erin, we'll start with you on this one. She asks, what is the homeless population count in Louisville, and how far will these 1,500 doses go?
So currently we just had, one of the things that the coalition does every year is an annual street count, otherwise known as the point in time count. We did one in January, and we are still in the process of finalizing all of that data. So I don't have a total number to release to you right now. I can at least say, in past years, the shelter population is usually around 1,000 individuals. And then unsheltered on the street, we usually find anywhere from like 120 to 150. So we are hoping that these 1,500 doses will meet the demand of everyone experiencing homelessness. But right now, I just don't have an actual number to tell you how many people are currently in shelter and on the street.
Erin, you want to explain how you did this year's count over multiple nights and why we're having a little delay in getting the report out?
Sure. So this year's point in time count was a lot different because usually we use about 400 volunteers and we do it over a kind of 2-hour blitz in the middle of the night. So obviously had to adapt that in light of COVID. And so this year we used strictly professional street outreach workers to survey during their normal business hours. So instead of that one-time 2-hour count period, we did it over a period of 5 days. So we found a significantly higher number of people, but I think that because of this year, with just having, the professionals that already know where people are, they're able to go look for them. We were able to find them during the day, as opposed to some people that, might be more hidden at night. So I am happy, when we do get to release those numbers this year, that I feel like it'll be a little bit more of an accurate portrayal of people living on the street.
Thank you.
Mm-hmm.
Thanks, Erin. Darby has a follow-up question to that, and she asks, how will these 1,500 doses allocated for the homeless population impact, or will it impact doses for the eligible general public? Dr. Moyer, do you want to take that?
Sure. So our homeless population, or those in transient living, are part of the 1B category. And so come before the 60 plus. And so that was why, now that we have this vaccine to get it out easier, we are prioritizing homeless with it, as while we also move on to our 60 plus in the 1C. So it's not going to impact that. Our allocation is increasing every week. And so every day we're getting more and more vaccine that we can get into the arms of general population. And we know that protecting our most vulnerable, or those that have the least access to resources, protects us. And so I am very grateful of our partners here today that are helping us do that.
Thanks, Dr. Moyer. And Mayor, that is the last question in the chat.
Okay, I want to thank the media for joining us today. We'll have another update on Friday morning at 10 a.m. out at Broadbent Arena, the LUVAC site. So thanks for covering this. And again, thank you to everybody that's been just such a wonderful part of this effort, whether it's public health department or volunteers, community partners. Truly amazing. We got a lot of momentum. Let's stay strong to the finish line. Thank you. Bye-bye.